Welcome, everybody. We're so excited that you're here to be joining this fourth and final session. I just wanted to take a quick moment to mention our upcoming events that the Physician Learning Program is hosting, the PLP Summit on advancing practice through the power of partnership. It will be here in Edmonton and on June 11th, 2024. And our keynote speaker will be Dr. Victor Montori from the Mayo Clinic. And we currently have out a call for abstracts, which close tomorrow. So hopefully you have an opportunity to submit something, and we're looking forward to seeing you there. So good afternoon, everyone, and thank you so much for choosing to be here today. This is our fourth and final session in our Follow the Spark series. We're so honored to welcome back all of our invited guests and speakers from previous sessions. Additionally, joining these panelists will be Melinda Noye, Executive Director, and Maureen Rossi, Programs Manager at Autism Edmonton, as well as Betty Hahn-Sidor, Manager of Planning Supports from Gateway Association in Edmonton. These sessions are hosted by the Office of Lifelong Learning and the Physician Learning Program at the University of Alberta in collaboration with Department of Psychiatry and the Prisma Research Group Precision Medicine in Autism. The PLP creates actionable clinical information by engaging with physicians, teams, partners, and patients to co-create sustainable solutions to advance practice. The PLP is dedicated to moving evidence into practice, fostering a culture and environment where everyone works together to tackle our most pressing problems, advance patient care, and create a world-class sustainable health system, which includes important topics such as the one today. My name is Kelm. I'm a research assistant with the Knowledge Translation team here at the Physician Learning Program, and I look forward to monitoring today's session. As we look to our past, present, and future, we acknowledge that we are on traditional territories across Canada of the many First Nations, Métis, and Inuit whose footsteps has marked these lands for centuries. A couple of housekeeping notes for today's session. As moderator, I'll be keeping my eye on the Q&A. Please use this feature if you have any questions for the speakers. And if you see any questions in the Q&A that are of interest to you, please use the upvote function. We'll do our best to get to all of the questions, but please note if we're unable to provide any patient-specific advice for clinical care at this forum. And we thank you to Melanie, our education specialist at the PLP, who will be monitoring our chat feature for any questions related to the technical difficulties or about programs and services. A recording of this webinar and a PEARLS document with resources will be sent via email to all those who have registered. Main Pro Plus participants will earn certified credits by completing a linking learning exercise. MOC and Main Pro Plus credits can be earned by completing a personal development activity using the My L3 Plan tool. And for more information, please use the QR code. This activity has not been formally reviewed by the CFPC or the Royal College. However, it is eligible for non-certified credits. The Office of Lifelong Learning and the Physician Learning Program, we promote an understanding and respect and inclusivity in discussing neurodevelopmental disorders. We use person-first language, emphasizing individuals over conditions, and interchange medical and social language to create an environment valuing and acknowledging the uniqueness and strengths of each person affected by neurodevelopmental disabilities. And I'm excited that these sessions have come to a close, and we have this opportunity to have a panel discussion, bringing back everybody that has been able to participate within these sessions. So as we look to introducing each person on here, before we delve into discussions, I'd like to take a moment for each of our esteemed panelists to introduce themselves. And as we pull everyone up here, I'm just going to start in the top. I see we have a couple people who are coming in hot. So we're going to start with Daniel Moreno de Luca. Dr. De Luca, if you could introduce yourself.
Hi, everyone. I'm Daniel Moreno de Luca. I'm an attending child, adolescent, and adult psychiatrist for the University of Alberta, Alberta Mental Health, and CASA Mental Health. Alberta Health Services. And I'm also the CASA Research Chair. And the aim of our group, the Precision Medicine in Autism group, is to use genetics to bring actionable clinical recommendations to the care of people with autism and other neurodevelopmental conditions who need that. So I'm very happy to be here and to be a part of this panel with all of you.
Excellent, thank you. And Dr. Bardoloi, I'll have you introduce yourself, please.
Hello, everyone. I am Prajjita Bardoloi. I'm a psychiatrist working in the Adult Neurodevelopmental Disorders Clinic. We are based at East Edmonton Health Center. And I am working with the adults that they come from the child psychiatry or other colleagues. We are very excited to be a part of this project. And as we are expanding, we are very new. We just started in May of last year, the Adult Neurodevelopmental Disorders Clinic. Yeah, that's kind of in a nutshell.
Thank you so much. Grant, can I have you introduce yourself?
Yeah, Tansei. Hello, everybody. My name is Grant Bruno. I'm a PhD candidate in medical sciences in the Department of Pediatrics at the University of Alberta. I'm a parent to 2 autistic children, and I'm from Musqueam, which is a First Nations community located in Treaty 6, about an hour south of Edmonton. And my PhD research is on First Nations communities and autism. Thank you.
Thank you so much, Grant. And Maureen, can I have you introduce yourself?
Hi there, my name is Morine Rossi. I'm the programs manager at Autism Edmonton. I come from an education background, so I was a teacher for about 15 years. And I also have an autistic son who is 13 years old. Thank you so much.
And Melinda.
Good morning, I'm Melinda Noye. I am an executive director at Autism Edmonton. I've worked with the neurodiverse community for most of my career, both from a community development perspective and others. At Autism Edmonton, we have 5,000 members who are autistic and support them across the lifespan in various ways, both from community support, things like our pantry program and our discussion groups, through to medical issues and diagnosis and participating in some of the groups like ECHO. I'm happy to be here.
Thank you so much. And Betty, could I have you introduce yourself?
Sure. I'm Betty Hahn-Sidor, Manager of Planning Supports at Gateway Association, and my current work and role on the Family Resource team involves helping individuals living their best lives, connecting families to be empowered advocates, facilitating workshops and planning individual support meetings, helping families to build skills, confidence, and resiliency to thrive. I've been at Gateway for about the last 13 years, and I've been in the field for over 40 years. Thanks for having me.
Thank you. And Dr. Orimalade, I did make you co-host, so you should be able to share your video now if you would like. Would you be able to share an intro for yourself?
Thank you. My name is Ade Orimalade. I'm a consultant psychiatrist with interest in neurodevelopmental disorders, including obviously autism. I have about 20 years experience working in this area. Half of that time was working in the UK, and the other 10 years has been working here in Alberta. I'm also involved with diagnosis in a quite innovative service in Edmonton at the Glenrose Hospital, assessing adults for autism spectrum disorder. The other part of my work is just working with individuals with intellectual disabilities, trying to support and treat individuals who have ID and comorbid psychiatric illnesses or just complex behavioral needs.
Thank you so much. We do have Dr. Lonnie Zwaigenbaum who will be joining us shortly. He's just tied up at the moment. I do thank all of those who have submitted questions ahead of time. So just a reminder to please use the Q&A function if you do have any questions that you would like to share. But we also have an opportunity if you would like to ask them personally to use the raise your hand function, and we can have you unmute as well and ask your question ahead of time. So I think to start, we will look at some of the questions that were submitted ahead of time. And we have quite a few questions regarding adult care. So I'm going to start maybe with Dr. Orimalade and Dr. Bardoloi. If you can kind of give some advice as to what primary care teams can do to help aid in the diagnosis of an adult with symptoms but no signs of intellectual disability.
Okay, so that's a great question, and I have to say that we're seeing more and more of that scenario nowadays, either due to real increased incidence of or prevalence of autism spectrum disorders in the population generally, or due to increased awareness. Perhaps more the increased awareness. The advent of the internet, social media means that more people are aware of the condition and are seeking answers. I think what family physicians can do with respect to adults who suspect that they are on the spectrum, who do not have intellectual disabilities, is firstly to be supportive, to validate their concerns, and then I would say there are screening tools that family physicians can use now. So practically speaking, the autism quotient is one such tool that can be used. There's the AQ10 item, very brief, and then there's the AQ50 item, the autism quotient, and this test can be found online. So if one does the screening test and the patient scores highly on those screening tests, they can then think of the next stage, which is, okay, you need a more comprehensive assessment. At this stage, this is where they can go different directions. They can refer to the Glenrose Adult Autism Diagnostic Clinic. The referral forms are on the AHS website. Sometimes, family doctors can have connections with psychologists that have expertise or experience in autism. They can refer to such people to carry out some kind of diagnostic assessment. Those assessments are also quite useful, even if that patient gets to see a psychiatrist in the future. Of course, there's also the pathway of referring to a psychiatrist, because really, a psychiatrist who treats adults most likely will have good working knowledge of autism spectrum disorder. So that could be another referral pathway. And a psychiatrist that sees a patient with autism who is then not sure after the assessment can refer to a tertiary service like the Glenrose Clinic. So to summarize, there are screening tools. The AQ is a very good, easy one to use. That can tell you whether, okay, there seems to be a need for more comprehensive assessment. And then there are several different pathways of referral that can follow on from there.
Excellent. Thank you, Dr. Orimalade. And that being said, I remember you saying, and I was quite impacted by the numbers you shared in your session about how long that delay is. And so it kind of gets me looking at Melinda. Melinda, I'm wondering if you could maybe share some insights that, what can maybe Autism Edmonton offer, maybe if someone doesn't have a diagnosis yet?
The wait lists are long and have been since I've worked with this community. But so our services at Autism Edmonton range from discussion groups for just about every demographic we can come up with. There's a 2S LGBTQ plus support group. There's women, autistic women, 2 groups that Morine facilitates one, and we have peer facilitating another one. Adults with autism, parents of adult children with autism. It's just the groups are absolutely numerous. We don't stand on ceremony in terms of diagnosis for people to access our services, and most of our services, like I said, are completely free. So if people are querying or curious, or even, just want to come in and chat with somebody about some guidance, where to go, or who they might talk to, in the meantime, while they're sitting on that waiting list, we are happy to open our doors to whoever might come through. Of the members that we have, many of them are diagnosed later in life, and that's part of the issue, is that they haven't received any funding for supports earlier on. We have programs for seniors that are really quite tricky, because many seniors have, sort of circumvented that whole process because they are older. We find that loneliness is such a huge factor with that population that inviting people in without diagnosis is really important work for us.
Excellent. And, I think having that behavioral diagnosis of autism, I think, means a lot to people, and building communities and support are really helpful. And so, but going on the diagnosis side, Daniel, Dr. Moreno de Luca, I just wanted to ask you about the genetic diagnosis and going down that avenue. Are there the same challenges within the direction that you want to take things with having the precision health side? And what happens if there isn't a diagnosis after testing as well?
So that's a great starting point, and it's a good opportunity to remind ourselves that genetic testing is the standard of care after a diagnosis of autism is made. So it comes after that clinical diagnosis based on the observation of the person in front of you in the clinic, and genetic testing will not replace a clinical diagnosis of autism. It's an important complementary part that can allow you to understand what led up to autism in some cases. And you can actually expect to identify a genetic cause in autism in about 1 out of every 3 people that you test. So there's a lot of important information that can come from that, from those genetic results. When they're positive, for example, it puts an end to a diagnostic odyssey, and it allows families to connect better with services, and it can alert about other potential medical conditions that may be on the background, even if they have not yet come to clinical light, with the goal always being to allow people to be the best version of themselves that they can be, and acknowledging that not everyone on the autism spectrum is going to need either a psychiatrist or is going to feel that genetic testing is right for them. So although this is a professional recommendation that is standard of care, it's important to remember that it's up to the families to decide whether this is good for them based on their values and their priorities, as long as they have good information. So that's how the diagnosis piece on the genetic side relates to the autism clinical diagnosis piece, differentiating that these are 2 different streams and that the genetics piece comes after that clinical diagnosis. Now, the access to this diagnosis is covered within Alberta Health Services, and it's a standard part of insurance. There's a couple of tests called chromosomal microarray and Fragile X that are done in-house in province, and this can be ordered by any specialist physician in the province, not only medical geneticists, but also neurodevelopmental pediatricians or neurologists. And then we are developing a whole host of infrastructure to build on the really great resources that are already available here like a genetic counseling service to see both children and adults that have already received the diagnosis, to talk about genetic testing and to carry that out if they feel that that's right for them. So again, the genetic piece comes after the clinical diagnosis. And thankfully, and I know that I'm a silver lining type of person, but I don't think there is an overwhelming barrier that is stopping us from providing these recommendations. We've been chipping away at several of the issues that we've encountered, including creating new clinical services and bringing awareness, like we're doing with the seminar series. So please reach out if at any point this is something that you want to consider. And if you have any lingering doubts, because I don't want people thinking that a genetic test will diagnose autism. That is not the case. And that's the big part to underscore here, although the value is very high after that diagnosis.
Excellent. Thank you. I appreciate that clarity there. I do see we have someone's hand up in the chat. I think we can ask to unmute and ask the question. Go ahead. Oh, yeah, go ahead.
Is that fine? Can you hear me?
Yes, we can hear you. Thank you.
Okay, I'm calling from your neighborhood, next province. This is Saskatchewan.
Wonderful.
I'm actually in Regina. I must apologize. I missed your previous talks. I attended the last one last week, and I know you dealt with quite a bit of autism in the past. The other two sessions. Now, and so my question may be sort of out of date because of what you've been through, but I'm going to ask it anyway. There are two questions that I have. One, I don't have experience with adult autism. I've seen, definitely, I see a lot of kids with autism, no doubt about that. They're easy to, well, fairly straightforward diagnosing. Now, if it is an adult, how do they present? Assuming they've not been diagnosed in the past as kids. So that's my first question. So in case you've dealt with it, I would want an answer from you, but I'll apologize for that. Now, the second part of the question is to do with services. As I say, I'm in Regina, and I see you guys have got a very established system of looking after, these cases, which I find gratifying because from the little experience that I've been exposed to, I've seen, parents come in with their adult kid. I think the one I know is over 20. And, they always come in complaining that, look, we don't have services, for this. So I'm not sure we have a good service. So my question is, in case we don't, and, and correct me if you know whether we do, how do we go about, getting these services, who do we need on the team? Because this is a very difficult situation. The kids, the young ones are probably easier to deal with. They got this attention. The adults are more difficult because they can't go to school. For instance, this boy can't go to school. Spend sets of hours in his room alone. Parents come in here and there. Sometimes he doesn't eat. Sometimes they come in and say, this chap hasn't eaten for the last 5 days. That kind of thing. So I don't want to stay too long because I know it is limited time. But those are my two questions.
Oh, excellent. Well, thank you so much for asking them. And I think they're very two important questions. So I think before we get into services, which I know is very difficult because it is so diverse, I think across provinces, but across cities, I see quite a difference just in Calgary to Edmonton and outside. But let's start with the diagnosis. Would anyone like to start with that one?
Yeah, I can talk about that. Before we go there, do you mind if I ask your background, your role? Is it like a caregiver or a physician or a family so that I can answer appropriately?
Yeah, actually, I'm a physician.
You're a family doctor. Okay, thank you so much. So, in terms of adults, it is, again, it's a good question to ask because We are an adult service and we see a lot of adults who have never been diagnosed or never even have been to any mental health professionals before, but they struggle their whole life. They will still have the same clinical, like if we look at the DSM diagnosis, right? Social interaction problems and communication problems, and they will still have those narrowed interests or repetitive behaviors and rigidity, all those things, right? So when you see someone like, you might have a question about maybe this person is neurodivergent. It would be very helpful to do those screening tests, like Dr. Orimalade has said. Like autism quotient test is available online. The 110 question or 50 questions are also easy to done. They can do it very quickly. It's online. Just have to click on that. And I'd like to add another one for females. It's called CAT-Q. Oftentimes you'll see masking of patients with females with mask, and adding the CAT-Q questionnaire would sometimes help if they score low on the AQ test. So those will be the first step. And then if there's any learning disability or anything as a child, I always emphasize on childhood history, like birth and developmental history. Was there any like stress or anything that might have injured that early brain, even during the pregnancy, right? Like that developmental phase is so important. Was there any complications at birth, or was there any serious infections? All those things will help you to understand maybe this person's brain was exposed to some kind of stress or trauma that may have, caused some developmental issue. Where our focus would be just looking at not just autism, but overall neurodevelopmental picture, right? Was there a speech delay? All those, having that good, thorough childhood and developmental history would tell us more about what this brain must have gone through and how it would impact their life in general as an adult. Oftentimes, you would see adults presenting with multiple different psychiatric disorders, like severe anxiety, severe social anxiety, like severe behavioral problems, or depression, like treatment-resistant depression, right? They will not respond to anything or very sensitive to medications, all those things. If you say that's something like not responding like the other patient, then what else is going on? Maybe we're missing something underneath. So that would also can raise your question, that red flag to go for further investigations. So that is how you would say. And often another part that we see is the personality disorders, especially borderline personality disorders. And if you look at how they overlap, like even in borderline personality disorder, you'll see that communication problem, that like interpersonal issues, right? So that there's lots of overlapping symptoms. And when a person who never saw a psychiatrist or a mental health professional as a kid or never got diagnosed, it presents with those difficulties, can easily be misdiagnosed with personality disorders. So those would be the key things that would lead you to go for the screening tests. I think that is what, in a nutshell, for you to go for screening. And I would invite someone else for the second part, I think, who knows more about the services. Thank you.
Thank you so much for that great information. And, I'm really hoping, I know with these great insights, we're so excited Dr. Zwaigenbaum could join us, and, getting that early detection piece is so important, and hopefully that can evolve. But kind of circling back to the question about services, and I think we're going to reach for two perspectives on this. One from those in services, and two we'll reach out to Grant as well, because I think it's so important to get that family perspective, in troubles finding services, and what do you do when you can or can't find those services. So Betty, maybe we could start with you, being at Gateway, and what are your thoughts on finding services when there's not a lot out there, and how to support families?
Well, I think that we look at it as it's not just one service that's going to help that family. It's the whole team and helping families navigate where there are resources and support. So not just looking at what can the doctor do, or what is the tool that we can use in this one circumstance. It's looking at the whole life. And probably something that's been touched on before is belonging, and how do we connect that person to their community in all ways, not just through disability services, not just through psychiatric, not just through the school, but holistically. How can families connect and be involved in their community, just like any other child can connect and be involved in their community. So belonging, taking a look at what the person's passions are, what their interests are, what their skills are, and where can we share spaces in community, where can we contribute, just like any other citizen.
I love that, Betty. Sharing spaces, it's so powerful. And I think you find those champions in corners you never expected to find. And so, Grant, what are your thoughts on that, you know, from the parent side, but also knowing all the work that you've done to create those spaces within communities that were never there in the first place?
Yeah, so as a caregiver, I recognize all the challenges that come with getting services, right? And all the different barriers that I think we face continually. Even, you know, my kids are all under 18. And so there's more access to services than they're going to have when they're an adult, right? And so now I got to be really like mindful of how do I make sure I set them up in a way and set myself up as a caregiver, because, you know, these things just don't end as soon as they turn 18. And so making sure that I'm really proactive in this and like really looking for those opportunities or creating them myself. As you mentioned, so even in Musqueam, I really see that there's a lot of opportunity there to just create things out of nothing. And that's essentially what you have to do when you work in such a low resource community. And so that's what I've done. You know, we've started autism support groups. We do our, in partnership with Autism Edmonton, we do our sensory TP, which hopefully we'll be doing again this year. And then now we're starting up a caregiver group. And so looking at all the different types of things that, you know, because the expertise for me, when it comes to these kinds of initiatives and this kind of work, the expertise is really with the people with the lived experience. And that's who we should be taking guidance from throughout all of it, right? And I really feel, and one thing that I've learned through my research is that unless you have that lived experience, you're probably getting things wrong in a way, some more than others, of course. And so I think that when it comes to supporting families, it's really important to understand where they're coming from exactly. And so for me, I recognize that a lot of the caregivers that I work with who are First Nations, they're dealing with challenges that go beyond even just a disability, right? They're dealing with a lot of jurisdictional issues between the province and federal governments. They're dealing with lack of culturally relevant services or people who understand their background as Indigenous peoples within Canada. They're dealing with racism, ableism. And so there's all these different intersections that are going on that need to be taken into account at all different stages. And I think as we look for services and supports, it's really important to take as much of it into account as you can and recognize all the challenges that our families do face.
That's great, Grant. So many different pieces to it. And I think, you know, the caregiver and the individual are so important because the people around that care community tend to change quite a bit. And so I think a lot of things to consider too are, you know, keeping within that primary care model and that patient's medical home so important for that long-term care across the lifespan. It's so important. I am going to take a second to thank Dr. Zwaigenbaum for being here. If you wanted to unmute and introduce yourself, we're grateful to have the opportunity here today.
Well, thank you. And with my apologies for running late out of clinic. So my name is Lonnie Zwaigenbaum. I'm a developmental pediatrician. I work at the Glen Rose Rehab Hospital. I have the pleasure of working with many people on the panel and having co-presented with Karen as part of the series, and delighted to be part of the discussion today. Thank you.
Excellent, thank you. And I'll have you keep your mic unmuted. A lot of feedback and questions we got were focused around the echo autism. And so how, most importantly, how can physicians and individuals be a part of that? So I was wondering if maybe you can speak to that, and then maybe we could actually also head up to Maureen and she can share some insights as well.
Sure, that's great. So I really appreciate the interest. It is really an open process in terms of if folks working in the community feel that it could be beneficial to have a chance to talk about children and youth that they're seeing and participate in some of the more didactic sessions. People are welcome. The ECHO I spoke about has a particular focus on medical management, but we have had a diverse group of professionals like in the school system and from other clinical areas participate, and it's really enriched the discussion. So maybe one practical point is to be able to communicate out when the next opportunity will be for participating in ECHO through this PLP group and including your contact information. Maureen, who is part of our ECHO Hub team, knows that we've had both the opportunity but also the challenge of working with a much larger group this session than in the past. But we're also aware that there's a group in Calgary that's looking at launching an ECHO that may kind of overlap in terms of the needs it addresses, so it may give us a bit more capacity next round. So I think what we'll do is just kind of keep in touch, and next time that we're offering ECHO, which will likely be early in the fall, we'll make sure that you hear about it. Anyway, so thanks again for your interest.
Thank you.
Thanks, Karen. I was just going to add that it's really great work for us as community partners to be able to be a part of this and understand the bigger picture that physicians are dealing with on the front end of things. Also, just giving that community support regardless of where the diagnosis or the case study is going. So providing that, again, that lived experience, the family perspective, and a different angle than what is typically delivered or talked about with the physician side.
Excellent. I love that the ECHO isn't just, I guess, for lack of better words, a bunch of physicians sitting at a table putting together a plan, that you're involving a good group of communities and lived experience to help with that model. You know, kind of reiterating a lot of what's been said here is that need to belong within a community and recognize that. Melinda, we had a lot of questions come in, and I'm going to send this to you about adult and housing. And so I know this could be a session in itself, but I'm wondering if you could just share some thoughts and ideas on that, especially recognizing too that we have people participating from Edmonton and area, and sometimes not within main centers too.
Interesting. So when I started here, there had been a couple of town hall sessions, and housing was one of 4 top areas that families were struggling with. And so over the course of the first couple of years, I was able to secure some grant funding for a housing coordinator position, and it's a provincial position. So we have Drew, who's working very hard in this office to not just support individuals and families with specific housing issues, although those come through our doors often, particularly because a lot of the folks that we work with have difficulty maintaining relationships with landlords or neighbors, finding apartments that are sensory suitable. So neighbors who smoke is often a complaint, or somebody with, barking dogs or pets or those kinds of things. So when I was in the UK 2 years ago, I got to visit the University of York, and they had a program where there was funding for students to be able to choose better housing that was more suitable. So neurodiverse students could ask for their own private bathroom or a corner unit on the top floor, those kinds of things. So so my eyes were really open to the possibilities, which was fantastic. So when Drew started, he, like I said, started initially supporting individuals. He's working now with landlords and property owners to develop suites that are suitable for the folks who are looking. And so Calgary was way ahead of us. They had already worked with the Sneem Family Foundation, with Autism Calgary, to have some of those suites available where, families could sort of or individuals could be directed to find some supports. And it's not necessarily supportive housing. It's, affordable housing, it's adaptive housing, it's any kind of, it's mainstream housing that might just be a little bit off the core of downtown, all of those pieces. So, Drew was going on a road trip across the province to meet with autism service providers and to talk about housing opportunities. He's starting with Fort McMurray next week. He's already been to Calgary. He's actually been to Calgary and Red Deer. And so meeting landlords there, talking about how we can stabilize housing for people in this community. And we have a wonderful housing provider who is purchasing 2 buildings in Edmonton. And we're working with them to provide some subsidized housing suites for our members. So lots and lots happening there. Housing is certainly on the radar of everybody across Canada with, Edmonton's housing situation in particular is very, very difficult for everybody. And the conversations that we have with some of the agencies serving the unhoused population are, how many of the folks that you serve are autistic? And the answer is often none that they know of, because they're dealing with so many other presenting issues like addictions and mental health. So we can't overlook that, and supporting people before they become unhoused is crucial. I'd like to give a shout out to Dr. David Nicholas at the University of Calgary. I just attended a research symposium there this week, and the panel was on housing and the unhoused, and it was absolutely fantastic. So there's lots of great work being done there.
Thank you, Melinda. And, again, it kind of all goes back to that sense of belonging and purpose. And, when we don't have a home and we don't have a place, it definitely, doesn't contribute to that sense of belonging. Betty, could you speak a little bit? I had a couple questions come in with people wanting to know about who can access Gateway services and how do they go about doing that?
Sure. So Gateway is a family resource center in the Edmonton region. And we also have an employment resource center in both Edmonton and Calgary. As with most nonprofits, we're dependent on donations along with government contracts and grants. So those services can change from one year to the next, but we try to support anyone contacting us. And that might be referring people elsewhere. For example, if they're coming to us in regards to AISH applications, we would send them to Voices of Albertans with Disabilities, which is a provincial organization. They help with that. We have a list of low-cost services to help people with guardianship, trusteeship, applications, and we help wherever we can. So we've, for the last 20 years, helped with family managed services, which is PDD supports, hiring staff and helping families with that. We currently have 4 out of 7 of my colleagues are parents of neurodivergent kids. And so we have firsthand experience around FSCD supports, applying for the disability tax credit, among other needs of families.
Amazing.
Mm-hmm.
I think, a lot of what I want to share here is that, we're in a time, and I think autism and other neurodevelopmental disabilities, physicians carry quite a load, specialists carry quite a load in wanting to support families and individuals and not knowing how to do that. And I think something I want to share here is that, Autism Edmonton, Gateway are just a few of the champions out there to really, support knowledge and families so that primary care and allied health professionals don't have to do that work, but they just need to know about referring these services and giving that knowledge and support. We did have a question in the chat. Maybe I will start with Dr. Zwaigenbaum, and then I'll head up to Dr. Moreno de Luca to finish off that. But could you speak to the value of a diagnosis, even though a child may be high functioning, and socially able to assimilate?
Yeah, so really interesting question. I'll kind of consider a couple parts of that. So first of all, your question makes us reflect, like, what is the purpose of a diagnosis? You know, whether we're talking about a child or adult. I mean, in some respects, it's about a sense of self-understanding and discovery, and relatedly providing a bit of a lens for family members and other people in the child's life, including teachers, to sort of understand where that person's coming from, sort of what their unique perspective is, and what some of the dilemmas they may face, sort of both obvious and less obvious. Another practical implication is a diagnosis can be sort of an entry point for supports and services. And, you know, and I think that we've been having a lot of that conversation today. I think another element is sort of this notion of socially assimilating. There's certainly a number of youth as well as adults on the autistic spectrum who talk about assimilating, sort of fitting in, sort of thinking about sort of what neurotypical folks are kind of expecting. That is a really tough process. It's very effortful. It can impact negatively on mental health, and it also leads to the person having the sense that they're just not able to be themselves. So that kind of circles back to sort of the diagnosis around sort of self-understanding, and links to services, because the opportunity, you know, having a diagnosis could mean that someone could participate in social and recreational groups that, you know, both in the general community and to sort of learn about what's available that's a bit more specialized, like say through Gateway or through Autism Edmonton. It's a chance to sort of reframe that person's differences in a more neuroaffirming way. So rather than feeling like they're always needing to be different, always needing to be someone that they're not, really sort of gaining a better appreciation for their strengths and how to kind of cultivate their interests and find ways of thriving, as other people on the panel have said. I think the other thing is that sometimes assimilating, you know, on the surface, you know, someone's autistic features may not be evident, but that personal experience of it can be really challenging, and providing the supports for the person to have positive social experiences, I think, can be helpful. And then finally, like sort of as a pediatrician, often when we're seeing someone for an autism diagnosis, you know, we realize that often there may be co-occurring mental health issues or physical health issues. So making sure that we're having an opportunity to understand that person's health needs in a more holistic way. And I'm delighted that Daniel's here, because I think that pediatricians and psychiatrists sort of have a complementary role along with other health professionals. So I'm sure Daniel will have lots to add.
I actually was going to comment that you gave such a good and comprehensive answer that I'll just add my 2 cents, but I think you hit the nail in the head in regards to all of those advantages. I would like to underscore again, maybe from a psychiatry standpoint, the importance of feeling good in your own position and understanding that this is just a different way of being in the world and getting the supports that you may need, which may not necessarily relate to what is referred to in the question as needing a higher level of support. Like, there's a lot of advantages, in my view, of being able to build on those strengths and understanding how you relate to the world a little bit better, and diminishing the guilt that may come from feeling that you don't fit in, or having to always keep up, like Lonnie mentioned, the effort of presenting yourself to the world in the way that the world expects to see someone who's typically developing in that space. And that is a big toll, not only for the kids, but also for the adults. So just using that as a way of understanding people better, and understanding not only what some of those challenges are, but also where a lot of those strengths can be based, and how to gravitate to a group that is supportive and nurturing based on your own interests, I think can be pretty helpful. I also don't want to brush aside some of the challenges that may come with having a diagnosis, even if it's someone who doesn't necessarily need extra high levels of support. So I don't want to minimize some of those challenges, but I do think that with that additional knowledge, they can be addressed head on. Now, on a side note, and given that I tend to, like, my restricted interest is genetics, to put it in a light way, I think that diagnosis would be the one that triggers that recommendation for genetic testing. So in the absence of either intellectual disability or very high needs of supports or other co-occurring conditions like seizures or congenital malformations, the yield of genetic testing will be much lower, but it could still be around 5 to 10% or so in that population. So that would still be additional clinical information that would come from that testing that would not have occurred had a diagnosis not been made. So a couple of extra cents to Lonnie's answer. Excellent.
Thank you so much. I think it's so hard. This time always goes so quick, and there's so many questions that everybody has. And I think we've done a great job of hitting most of the questions in the chat. Recognizing the time, I did approach all our panelists and give them some work to do over the last couple of days, and told them that I would be asking each panelist to please, provide some key takeaways that they would like to share to everyone in attendance before we do a wrap up. So don't go anywhere. We're going to have everyone share their insights, and then I have a evaluation form I need you guys to fill out. You get a chance to enter into a draw for a Starbucks card. But before we get into all of that, I think we have some key insights from some very different perspectives from everyone along the board here. So I'm gonna just kind of start maybe once again with the order in which the sessions went. So Dr. Zwaigenbaum, you're up first. What are some key points that you want people to take away?
Boy, I feel like I just showed up to school without bringing my homework, but it's a great question. And I think what comes from the heart is that when we talk about assessment and diagnostic needs, like, it does take a community. Like, at a time where about 2% of the population would meet criteria for an autistic diagnosis, this is not a condition that can only be seen in a specialized clinic by a small number of people with kind of a very narrowly defined training. And there is a diversity among assessment needs, so all of us working together to support the process, and also making sure that families and individuals are feeling like they're getting good assessment close to home, people who understand them, and also kind of have an ongoing relationship. I mean, similarly, when we think about healthcare, it's not about seeing a specialist to treat your autism, but it's about being an autistic person who has the same breadth of healthcare needs as other Canadians. And again, that's where it takes a community, and that's where it takes kind of a more of a person-centered approach to not just treat somehow illness or diagnosis, but really create opportunities for health. And that's through the broad range of areas that we've talked about today, not only through the healthcare system, but thriving in the community, having an opportunity to participate in recreation, have an opportunity to pursue one's goals in terms of post-secondary, living in the community, having satisfying relationships. I mean, the slide that Karen had presented in our presentation about the F words, I think is a really nice way to think in a holistic way. And again, there's nothing that's particularly unique about the needs of autistic people and neurodiverse people that way. I mean, when we think about our own personal and healthcare needs, they're equally rich and complex and multifaceted in the neurodiverse populations. So anyway, thanks again, Karen. It's been a great session.
Thank you so much, Dr. Zwaigenbaum. Dr. Moreno de Luca.
I'd like to pick up where Dr. Zwaigenbaum left off and start with a quick couple of general points, which are that the goal in the clinic is always to allow people to be the best version of themselves that they can be, and that is going to be very different across the board, and including some people who may not need to come to clinical care. So it's just an underlying that diversity that characterizes autism. The second piece is that we should think of genetics, with that being the focus of my presentation, as an extremely relevant part of the workup after that diagnosis is made, because of all the benefits that we mentioned. And we should really underscore the fact that it is our professional obligation to have these conversations with the families and not to do genetic testing, but to empower them so that they can make the decision that best aligns with their values. The third would be that genetics is not deterministic. It's just one of the things that make us who we are, and there's a whole lot of space for us to craft that path. And this is just an extra piece of information that can allow us to not only address some potential challenges, but also to build on those strengths. So in a nutshell, that's kind of the messages that I would like to highlight.
Excellent. Thank you. Dr. Bardoloi, what would you like to share? Oh,
I think you're on mute.
I think you're still on mute.
Sorry about that. Thank you. And I have a few points that I would like to share. One is we have to be aware that neurodiversity is it's very prevalent, right? Different forms of neurodiversity. And we have to have a more, inclusiveness. First of all, right? Oftentimes when I talk to the patients, like who there's no LD or anything, they just have autism, for example. And then when we discuss and when we talk about maybe, do you feel like if a square trying to squeeze into a circle? And I had patients crying when I asked them that, because they exactly feel that way. Like I feel like a square being pushed around and pulled to put it in a circle. So we have to understand their unique needs. We have to be more accommodating, trying to bigger our circle to include them. If you are a physician, if you are a primary physician, give them accommodations so that they succeed in their life. Everybody has some strength, and we have to have a strength-based approach. Like the other day, Grant had very rightfully pointed out why we are looking at all the deficits, right? But this standard is created by us. And how can we change our own perspective and help them succeed in their life, right? Oftentimes we hear somebody gets diagnosed with autism as an adult. Of course, they need services like AISH, but what else can they do to succeed in their life and become more productive and be successful in whatever their strengths are? So that would be one key point, like strength-based approach, accommodate and advocate for your patients. If you're a caregiver, you can still go find the doctor or the psychiatrist to accommodate for them. You know, I have students who would do much better if they have less courses they can't take the full course load, but they're not allowed to in the university, and they would do well with 3 courses, for example. So if a letter from you would help, please do so. Then number 3 is how we can help them grow as a person, identifying their strengths and not yes, of course you have to focus on the negatives, but what can strengthen those those strengths. That is what, docs before me said, it takes a village. Yes, it takes a whole community to help these people. And this, we need to be more flexible than, to include circles, squares, triangles, everything, right? That's what it is. My request to everybody. Thank you so much.
Excellent. Thank you so much. Dr. Orimalade, what would your key takeaway point be?
Thank you. So I tried to, in our presentation, break the whole autism question down into how truly spectrum this autism spectrum disorder is. It's very heterogeneous. And because of that, not one size fits all. So my take-home message after all these sessions is that what works in autism is tailored intervention that is person-centered, that focuses on the patient and involves the person as much as possible, that looks at the person's strengths, that considers other things like housing, that considers work, that considers relationships, and that moves in the direction of inclusion, independence, validation. We can talk about the gamut of medications that can be used in autism, but really at the bottom core of what works is holistic, tailored, person-centered intervention.
I'm seeing a theme here. I love it. And one thing we didn't mention was employment, but again, I think that one could have lasted a couple of years or a couple hours. in conversation too, but thank you so much for those great insights. Melinda, I'm gonna head up to you now. What's your one key takeaway you'd like everyone to show? Oh, actually, I do apologize. Grant, I'm gonna pass it to you. You were next on that session. What would your one key takeaway be?
No, thank you, Karen. Anytime I've interacted with healthcare providers, educators, anybody who's ever worked with my family, OTs, SLPs, and just generally people I work with, even at the university, there's one common thing that I always feel that really builds that connection. And it's that ability to listen. And, when I think about listening, I'm guilty of this, is often when you're having that interaction with somebody, you're often coming up with a response even before they're done talking. And that little apprehension or that little bit of time you can give for just to be able to stay present is that ability to build that connection between you and that other person. And then that other person that you're interacting with feels heard. And that's another really important piece to this, because if you don't feel heard in these interactions, you're not going to feel safe. And safety, especially as an Indigenous person, is key, and trust and all these different things that go into it, right? And so I've really appreciated anybody who's worked with my family, that ability to build that relationship and then maintain it as well. And that goes beyond professionalism, right? I feel like policies, professionalism can get in the way of relationality. And as an Indigenous person, that's what we're looking for. So just thinking about ways to build that connection through listening, through getting to know each other, and even through vulnerability if you need to.
So powerful. Thank you so much, Grant. I appreciate that. Melinda.
Sure, thank you. I think the thing that I would like to leave with everybody is, particularly with physicians, is please don't hesitate to refer patients to social organizations like Autism Edmonton and Gateway. We have the time and the capacity, not always the money, but the time and the capacity to spend the time with people and to sit and help navigate those challenges that they may be facing, whether that's pre-diagnosis or post-diagnosis, somewhere along their journey. They're going to need a hand and a person, like Grant said, to sit and listen and to help find their way. So that is our role, and we're happy to fulfill it. So if there's information that is needed, it's particularly the contingent of people who's in Alberta whose IQ is higher than 70, who don't receive PDD funding as adults, that once they hit 18 are really in need of some supports and a friendly face, because they lose that active support that is funded by the government. So we are here for it. We can help navigate health and government services. We can help with family and social connections, and even the most very basic things like food and housing security. So don't hesitate to send people our way.
Thank you so much, Melinda. Maureen, what would your one key takeaway be?
Sorry, I think I'm just repeating a lot of what all of you have said, but the around belonging and connection and relationship, I think is really key there. So folks feeling like their doctors actually know them and care about them, folks feeling like their community knows them and cares about them, and that creates that safety that they can come out and figure out what their neurodiversity looks like in their life.
Well, I think it just shows how important that is. So thank you for really reinforcing that. And Betty, what would you say your key takeaway would be?
Hard acts to follow here. To piggyback on what Melinda said, just building that understanding that you're part of a team and building those connections with the resources in the community. We want to build the capacity, so helping educate families. We have lots of online learning that's going on, building that confidence. So those mentorships, the expertise of other caregivers and coming together in those groups and learning from one another, and the advocacy piece. So, knowing what your rights are and what to ask for, and educating yourself on the options that are available out there.
Wonderful. And I'm going to share one key takeaway that I want to take that's a little bit different from most people here. And what they were saying is the load the parents carry in doing all of this, because it is a relationship and it is so important. There's a ton of research out there that really talks about how the parent-child relationship is so important in development and life skills and everything there. And we really need to focus on giving parents that opportunity to be parents, not caregivers, but be parents and be the best selves that they can be, and really focus on that strong relationship between parent and child. And that way, you know, we can lean on Gateway, we can lean on Autism Edmonton, and we can lean on our healthcare providers to give us the support that we need, so that A, we can take care of our own health, and B, we can take care of our children and foster that strong relationship and not have to do the demand of many other things there. So I just want to thank everyone for being here. I'm going to do a quick little screen share to just say thank you to everyone who is in attendance. We are so fortunate that at the Office of Lifelong Learning and the Physician Learning Program that we are continuing our knowledge and investigation in supporting autism and other neurodevelopmental disabilities by further research investigating, you know, healthcare utilization and access to services that individuals are using. So please stay tuned for some more great things that are coming out. Take a moment to please fill out this survey so that we can have some good feedback and plan for their sessions. It shouldn't take more than 5 minutes, and you'll have an opportunity to join a raffle for a $10 Starbucks card that will end on March 28th. And once again, don't forget that we have an upcoming PLP summit that we would love to see you all there, and not to mention the really great opportunity to hear Dr. Victor Montori speak as well. So put that in your agenda, sign up, grab those abstracts, and we would love to see you in Edmonton for those events. So once again, thank you so much. I'm sad that this is over, but I'm really grateful for the opportunity to not only connect with everyone here, but to hear all your wisdom and insights. So to my chagrin, I must say goodbye. And we will be in touch. We will be sending out a link to the recording. And once we get everything put together, we'll also be sending out a Pearls document with some key pieces of knowledge. So thanks, everybody. I appreciate your time, and we'll be connecting hopefully again soon. Cheers.
Great. Thank you.
Bye, everyone.